Is it safe to delay your period? Well, this is a question I often get asked by many women, especially when they have that big event coming up, like a wedding, occasion, party, or even if they're going on holidays. And there are so many questions they ask around this topic. So in today's video, I'm going to be breaking it down. I'll be talking about how to delay your period, what are the risks involved, and answering some of the most commonly asked questions when it comes to delaying your period. So of course, you probably will be seeing on social media that natural remedies can help delay your period. So some people talk about drinking apple cider vinegar or just drinking vinegar alone. Says there is no such thing like that. There's no studies out there to back these claims, so these claims are false. So now that we know that we cannot do that, let's talk about how to delay your period. You can delay your period using different methods. One, you can delay your period by taking a medication called northisterone or another medication called medroxyprogesterone. Or if you're someone that uses the combined pill as a contraceptive, then you can use this to also delay your period. Now, let's break them down. In today's video, I'll specifically be focusing on northisterone or using the combined pill to delay your period. Let's talk about northisterone. So northisterone is medication that's used to delay your period. It's normally taken 1-3 times a day. It comes as 5 milligrams, and it's normally taken, or it should be taken, 3 days before your period is due. If you take northisterone a day before your period is due, the medication might not work or it might not be effective. You might still experience bleed or even spotting. How does it work to prevent period from happening? When our period is due, our progesterone levels drops. Once it's dropped, then of course the lining of the womb is shed as a period. Northisterone is a synthetic version of the natural hormone progesterone. What it does is it prevents your progesterone levels dropping. So it keeps the progesterone levels high. Once your levels are high, then of course the lining of your womb is not shed. So now we know a bit about northisterone. Let's talk about how to use a combined pill to delay your period. If you're already taking the combined oral contraceptive pill, then delaying your period should be straightforward. There are 3 categories of the combined contraceptive pill. It's important to check with your healthcare provider or your pharmacist which ones you are taking in order to postpone your period safely. So for example, if someone that's taking a monophasic 21 days pill, then what you can do is you can skip your 7 days pill. So that's the pill that will give you the withdrawal bleed. You can skip that and go straight onto your next packet. You don't need that 7 days break, because that 7 days break normally just give you withdrawal bleed. So it's not an actual period. So now that we know how to delay your period, let's talk about some of your most commonly asked questions when it comes to using period delay tablet. So number 1 on the list is who can delay their period. So women between the ages of 60 to 54 can delay their period. So first, they consult a healthcare provider. If you're someone that smokes or obese or at risk of blood clots or has had previous or past blood clots or heart attack, then this medication may not be suitable for you. If you would like to delay your period and you fall in this category of women, then please speak to your healthcare provider. Okay. Number 2 is how long can you safely delay your period? So you can safely delay your period up to 17 days, but please follow the instructions given by your provider. Number 3 is when is my period likely to return after delaying your period? So your period should return 3 days after stopping the medication. Number 4 is it safe to delay your period? It's generally safe to delay your period. Someone that wants to delay the period as a short-term basis, then yes, definitely it's safe to delay your period. It's also safe to delay your period. However, what you need to know is it can mess up your menstrual cycle. So if you're someone that is used to having a regular menstrual cycle, your menstrual cycle might change if you keep on delaying your period. Studies have also shown that it is safe to delay your period. However, you might experience breakthrough bleeding or spotting if you continuously delay your period. Number 5 is, does northisterone causes weight gain? Well, there might be a short-term weight gain, or this might be caused by the bloatness. This should be normalized once you have stopped the treatment. Number 6 is, does northisterone reset your cycle? So I mentioned earlier that period delay tablets can change your cycle. Number 7 is, northisterone a contraceptive? No, northisterone is not a contraceptive. So if you are taking northisterone, please use a barrier method such as condom to protect yourself. And last on the list is northisterone effective? Northisterone is effective if taken according to the instructions. Many women find that period delay tablets works for them once they've taken it as it's been prescribed. If you do not take it as it's been prescribed, then please note that it might not be effective. You might end up bleeding or spotting, as I mentioned earlier. Alright family, I shall end this video here. If you did find it very useful or informative, then please give it a thumbs up. Don't forget to subscribe and share with your loved ones, and I shall see you all in my next video. Take care. Bye.